As people approach their 65th birthday, they have many questions about Medicare since it will soon occupy a central place in their health care. Danielle Roberts is a Medicare expert with the answers seniors need. In this video, the author and founder of Boomer Benefits, a 19-year-old national agency specializing in Medicare-related insurance, discusses the vital differences between traditional Medicare and Medicare Advantage, the non-medical items that could be covered by Medicare Advantage, how working seniors should approach Medicare, and why you shouldn't believe all those Medicare commercials you see on TV. As she is in Texas and I'm in California, we'll be conducting the interview via Zoom. Hi again, it's Jeff Hoyt, editor-in-chief of SeniorLiving.Org, and today I have the pleasure of speaking with a Medicare expert, Danielle Roberts. Welcome, Danielle.
Thank you very much for having me.
Well, thanks for taking the time. I think I should start out by asking what makes you an expert in Medicare?
Well, for the last 19 years, my brother and I have been helping baby boomers navigate their entry into Medicare. We started in a little tiny two-person office back in 2005. And today we are in a call center in Fort Worth with 130 employees helping boomers across and seniors across 49 states. So we have a lot of experience of helping people learn what they need to know when they're coming into Medicare and then making good choices for the plans that help supplement their Medicare.
And over your shoulder, I also see a book that you wrote.
Yes. That is the 10 Costly Medicare Mistakes You Can't Afford to Make book. And we wrote the book a few years ago. We update it every fall on Amazon, so the numbers are always current. And this is just walking people through the mistakes that we see people make time and time again as they're coming into Medicare. Had a conversation with our customer service team manager, and we were just talking about how there should be a class for people when they turn 50 to let them know all of the terminology and all of the pieces and parts, because a lot of times people will get to age 65 and suddenly they need to enroll in Medicare. It's a big national healthcare system with a lot of moving parts. It's very overwhelming and confusing for them. And really at the bottom of everything, they just want to get their enrollment right so that they don't end up with a gotcha or a surprise or a penalty that they weren't expecting. And that is what the book is all about, the things that we see people get wrong the most often and how to avoid those in your own Medicare enrollment.
Excellent. We will get into some of those mistakes. Just when I think of Medicare in my future, I think of it as a way to help pay my medical bills, my hospital bills, not, ooh, there are penalties. That sounds a little scary. And just like I think high school kids should get personal finance lessons, maybe seniors should get some Medicare lessons. So we'll do our best to give them a little taste of a classroom today. So if we were just signing up for Medicare, it's the U.S. government, a senior turning 65, and it's just like, okay, sign here, fill out the paperwork, we're good to go. Well, that'd be tough enough. But now there's also Medicare Advantage. So could you tell me how people should decide between whether they're a good candidate for traditional Medicare or if they should try Medicare Advantage?
Yeah, and it's a really important question to consider because the two ways are very different. So traditionally, we've had just original Medicare, and a Medicare supplement or Medigap plan is something you can add to your Medicare that helps to pay the deductibles, copays, and coinsurance that otherwise you would pay under Medicare. So I'd like to tell people that Medicare itself is actually very similar to group insurance that you've had through your employer during your working lifetime. You will have you'll have a premium that you'll pay for that insurance on a regular basis, just like now. Maybe your employer pays a portion and you pay a portion, and they're deducting that out of your check. Well, if you have insurance that works that way at work or in an individual plan that you might buy through the health insurance marketplace, you will know that coming into Medicare, it's kind of the same thing. There's going to be premiums that you pay for certain parts of Medicare. And just like you pay Geico for them insuring your auto risk, you're going to be paying something to Medicare for insuring and, covering your health risks. Really important piece there. And in the 60s, when Medicare was created, almost immediately they created these Medicare supplement plans because, for example, today, if you were to go into the hospital with Medicare, under Part A, you would have a deductible of $1,632. Well, that might be tough for somebody living on a fixed income that's retired. So they created these plans to cover those. And the primary reason that someone would choose to stay with original Medicare and add a Medigap plan is the network is Medicare itself. So with a Medigap plan, all you have to do is ask your doctor, do you take Medicare? If the doctor says yes, then your plan is going to pay just like it's supposed to, and your doctor has to accept it. So it doesn't even matter which insurance company you buy your Medigap or Medicare supplement from. It's going to work just like it should. So what this does for you is you can go anywhere. So if you develop a disease and the best specialist in the world is at the Mayo Clinic for that particular disease, you can go there because you're not worrying about a network. 90% of providers out there accept Medicare, and you would be able to go in and get that treatment there. So you have the freedom of access. It's great if you snowbird or you travel, you're going to be using it around the nation at different urgent care facilities, or maybe you spend 3 months with your granddaughter every year and you want to go live there and you want to be able to see a doctor while you're there on Medicare. That's what you have with traditional Medicare and Medicare supplements. Advantage plans were created much, much later in the history of the Medicare program, and they were primarily to help people that couldn't afford Medigap plans. We wanted to have an additional option for something less expensive upfront so that less people would be just running with straight original Medicare and having so much exposure to deductibles and coinsurance that can get really high on the outpatient side. So with a Medicare Advantage plan, you pay a very low premium. But now you're working with an insurance company, and that insurance company operates a network in your local area, and you go and see those providers on that network. So this is going to be something that's maybe better for people that like to keep closer to home. They don't mind treating in their local area. If they did need to go outside of their local area, they're comfortable with the fact that that provider outside the network could say, nope, not going to treat you. Or if they did say they would be willing to treat, then you're paying out of network rates, which of course are higher expenditures for you. So Medicare Advantage is kind of the opposite of a Medicare supplement, where instead of having a million providers to choose from nationwide, you're going to work with a much smaller group of providers close to where you live. It might be an HMO or a PPO. It might span a couple of counties or even statewide where you live. And those plans, they many times cost as nothing at all. They call it a zero premium. And you can imagine that people living on fixed incomes really like the sound of that. And so we see over 50% of beneficiaries today signing up for those Advantage plans, but a lot of people don't understand how they work. And that's really one of the biggest problems we see with Medicare beneficiaries is they get a little dazzled by that low premium and they forget to ask questions like, is my doctor in the network? Is my favorite hospital in the network? Is my physical therapy provider in the network? And I take these 7 drugs, or all 7 of those drugs, on the built-in formulary in that plan. And so there is some due diligence that you need to do as a beneficiary in making these choices, because you want to make sure that if you go the Advantage route, we check those things.
Those are all really good points and a lot to digest. I may take 1 or 2 of those and go a little further. For example, you mentioned whether a drug you take regularly is on the formulary for a Medicare Advantage plan or if your doctor's on it. And for me, it's like, it's one thing to say, hey, check this list for these physicians, check this list for these meds, but you can't anticipate what's going to happen in the future. And if you need a specialist, and in your town, the specialist who does take this particular Medicare Advantage plan is booked up for 3 months. I mean, is that a situation that people on Medicare Advantage could face?
Yeah, potentially. Yeah, I have an example about it in my book with a client that wanted to go with a Medicare Advantage route, and he suddenly started having fluid building up in his abdomen, and he was having to go to the hospital and have that fluid drained out of him every few days. And he was waiting to see a specialist, and the only specialist that could see him on that network was on the other side of Dallas, which is over an hour away from Fort Worth, where he was living, and couldn't get in to see him for several weeks. So is there a possibility that you may end up in a situation like that when you work with a smaller local network? Yes, you absolutely could be in that situation. And those are one of the things you have to ask yourself whether you're comfortable with that potential.
Danielle Roberts has a lot more for you regarding Medicare, so tune in to part 2 of our interview.